Welcome back to the community practice on autism spectrum disorder and other developmental disabilities. We are excited to be here today with 8 sites, over 100 people joining us online throughout Wisconsin, and apparently somebody snuck in over the border, I think from Minnesota. And so we will find you and we will charge you the extra fee, just so you know. Not at all, we are glad, so glad that you all have joined us. We're going to continue our learning about mental health and autism spectrum disorder and developmental disabilities. We are really excited to welcome in our partners from the National Alliance, our Mental Illness Wisconsin chapter, NAMI, Wisconsin. Emily Smiley and Megan McLachlan will be joining us to share what they have learned and what they know about mental illness and youth. And we've also expressed that anything that they know about their intersection then with autism spectrum disorder and disabilities, if they would also share that. So Megan and Emily, thank you so much for being here. I see your slides are being shared beautifully. Take it away.
Sounds good. Thanks, Tim. We're glad to be here. I have been the host site for this event many times. So we are going to talk a little bit. So I'm Megan McLachlan, and I'm the education coordinator for NAMI Wisconsin. And I will let Emily introduce herself.
Hi, I'm Emily Smiley, and I am the program director for NAMI Wisconsin. Thanks for having us. We're excited to be here. We are lagging a little bit, Megan, so hold on one second.
There we are. Okay, we're going to talk a little bit about who NAMI is. A lot of you have heard our name, and we want you to be aware of where NAMIs are and how you can connect with your NAMI. So NAMI is a national, actually international organization. And it did start in Wisconsin. It started in Madison. It started with 2 moms whose sons had schizophrenia, and they felt like people were seeing their sons' illnesses and not their sons themselves. They started a chapter in 1977. They got together. In 1979, they had their first get together. They thought there'd be about 30, 40 people. That was their hope. And they ended up getting over 400 people coming, and realizing that this was definitely something that nobody knew where to go to, who to talk to. So we're very proud of our roots starting here in Wisconsin. So there is the NAMI National. They do a lot of advocacy, and they there's so much going on. If you want to just check out the national website at nami.org, you will find so much information. So please use that as a resource. And then statewide, 49 out of the 50 states do have a state NAMI. The one that doesn't is West Virginia. Just it's a good this NAMI trivia for you if you're ever in a NAMI trivia competition. There you go. They do have some local ones though. And then there's the NAMI local affiliates. So here in Wisconsin, we have 27 affiliates. Of those 27 affiliates, 11 of them have paid staff. So there's some like Southeast that has, I think, 23 staff people. NAMI Fox Valley has about 11, plus they run a peer-run respite facility. There are others that are completely volunteer-run, like Lake Superior South Shore that recently expanded from just Douglas to the whole South Shore of Lake Superior. Northern Lakes, Northwoods, a lot of these are volunteer run. So if you live in an area in the light blue that does not have a NAMI, you're more than welcome to reach out to your closest NAMI, and Emily will cover some material at the end that are available to everybody in the state. So here's what we do at NAMI. Here are our four pillars. So we support, we have no cost. Everything we do at NAMI is for free, unless we're doing it for a specific agency that wants to use some of our material or needs a training sooner. Everything we do for all the affiliates is free. So we have support and education. Some of you might have been a part of some of our education classes like family to family or peer to peer. We have a new one called Hearts and Minds. We are involved in awareness, and we are involved in advocacy. And luckily, we have just recently been able to hire an advocacy director, and we do have a lobbyist who is on the Hill lobbying on the behalf of the needs for mental illness and mental health challenges. And so our advocacy pillar, which has been sort of the one that wasn't getting as much attention, is now getting a lot more attention and love. So it's pretty neat. We got to have a lot going on advocacy wise. So here's some of the statistics with mental illness. And I want you to pay attention a lot to the first one. This is so interesting, and I don't think a lot of people realize this. So 50% of all lifetime cases of mental illness begin by age 21. I mean, by age 14, I'm sorry, you guys. So this is one reason we really, really talk to high school kids. We particularly like to talk to freshmen. We have quite a few programs that go out and present to high school kids. And like I said, particularly freshmen. 75% of mental illnesses will show up by age 24. This next statistic won't surprise you. Again, I saw someone's comments preaching to the choir, 50% of students will drop out of school. So that number's just horrifying. So 70% of youth in state and local juvenile justice systems do live with a mental health condition. And suicide is the third leading cause of death, 10 to 24. And this next bullet too, mental health awareness is often overlooked in school curriculums. Some schools are doing an amazing job with this. They just blow me away when I see what they're doing. Others, maybe give it a day. So it really varies across the board. And learning how to recognize symptoms early can lead in successful recovery. So the sooner you get treatment, the better the outcome, which is one reason that we do go out and talk so much to teenagers. So many times there's an 8 to 10 year lag on getting treatment. And the sooner they can get help, the better. So how common are mental illnesses co-occurring with people on the autism spectrum? 70% of kids on the autism spectrum have at least one mental health disorder or mental illness. 41 to 50% have 2 or more, and anxiety affects about half of those that live on the autism spectrum. And these statistics are from Rogers Behavioral Health. Emily, you want to talk about this slide?
Absolutely. So in Wisconsin, the Office of Children's Mental Health about 2 weeks ago came out with their annual report. So all of these statistics are from 2022, which is really recent information. And this is about youth across the state of Wisconsin. So bringing it back, which is that 52% of youth reported anxiety, 34% reported feeling sad or hopeless every day. 22% reported self-harm, which is like a staggering statistic. And the other thing that's really important to note from this slide is that the belonging in school and how youth are getting help. So the majority of youth are getting help through their schools, and whether or not they feel like they belong and are connected to their school community is really important. And we know that this is something that all teens struggle with, but also especially those who live on the autism spectrum. And as you can see, even before the pandemic, the percentages going down on how much youth felt like they belonged within their school community. So we've really seen really significant drops in that. So this again came from the Office of Children's Mental Health 2022 annual report. So really recent data.
And we have Andrea on the line who said, way to give a shout out. Hello, Andrea. And so what are let's look at some of the warning signs for mental illness. And you guys are gonna, I'll get this slide deck. So some common warning signs: feeling sad or withdrawn for more than 2 weeks. And usually we say this isn't if life circumstances have changed. So seriously trying to harm or kill oneself or making plans to do so. Severe out of control risk-taking behavior, and this can be more difficult in teens because part of the risk takers, that's just part of being a teenager, but it's that severe word that you pay attention to. Sudden overwhelming fear for no reason. This is how kind of mental illness showed up in my son's life when he was like a 6th grader. And he's on the spectrum, and he said, I'm afraid, and I know there's no reason to be afraid, but I'm afraid. And that's when we knew we had to get him some help. Not eating, throwing up, or using laxatives. Seeing, hearing, or believing things that are not real, so auditory or visual hallucinations. Repeated use of drugs or alcohol. Dramatic changes in mood, behavior, personality, or sleep patterns. And we're going to talk a little bit about, just to touch on kids that are non-speaking, and this is one of the main ones you would watch out for. Extremely difficulty in concentrating or staying still. This was the warning sign I discovered that I needed help. In college, I couldn't sit still. I had to be like pacing in the back, and ended up getting diagnosed with bipolar type 1. And so everyone's warning sign is a little different. And finally, increasing worries or fears that get in the way of daily activities. And unfortunately, yeah, like this is a one that very, very often coincides with the autism spectrum. So as I said, if you have kids that are adults in your life that are non-speaking or minimally verbal, you just really want to watch out for changes in behavior, changes in mood, changes in eating or sleeping, irritability, withdrawal. And I did find a really amazing website that specialized in this, smiadvisor.org, had some really fabulous material. So please feel free to go there to get more information about this. And what do you do if you notice some of these signs? How do you start the conversation? You know, we all know these I statements, but it definitely helps when all these statements start out with I. So I've noticed you're sleeping more, less, etc. Is everything okay? You know, this is a great way to start many statements with teenagers. Younger kids definitely have mental illnesses, though. I am a parent peer advocate, besides working for NAMI Wisconsin, for the Neenah School District, and I work with kids that are K through 5th grade. So it definitely knows no boundaries, unfortunately. I've noticed you haven't been acting yourself. Is something going on? It worries me to hear you talk like this. Let's talk to someone about it. I like that one a lot. You know, there are a lot of schools that do have therapists right on site. I wish there was more. Hopefully, with this being the year of mental health, a lot of that will expand. I'm always here if you need me. And I want you to know you're not alone. I'll always be here for you. So I like what's on that little tree. Be patient, understanding, and provide hope. You know that this is a journey. You know, now my son is 24. He still talks to someone. You know, you're going to have times when, you know, you will be working with some of this, other times when hopefully things are going good. But just know that it's a journey. And then offer support. And this works for friends too. Sit down and look for mental health services. Can I help you make an appointment? I feel like my kids are just finally doing this on their own at 22 and 24. So that's just something that is hard for people who want to text everybody, or, you know, maybe there's an in-school therapist and they just are having trouble taking that step to get in to see them. some things that they can do till they help feel better. Or would you like to go to a support meeting? And we again, we'll have some NAMI resources that are available across the state that we'll talk about in just a little bit. And language, there's almost so much about language, and you guys are the first people to know all this. And so some stigmatizing language is there on the left. And you might be wondering why bipolar is a stigmatizing language, but so many times people use it. If you're not using person first, if you say, oh, that person's bipolar, well, it's a person that's living with bipolar illness. They're not their disease. So schizophrenic is another one. They're living with schizophrenia. So always make sure you do person first, just like we do in the autism community. And here's some just stigmatizing phrases that we hear, unfortunately we hear in the playground, we hear from other parents, we hear at event nights. So if you guys have anything you'd like to add to this list, please go ahead and pop it in the chat.
All right, so I'm going to jump in, but we know that Megan went over those warning signs that you can see and the changes in behaviors. And, the first step to make those changes is using language that is person first and non-stigmatizing for all individuals, regardless of whether they're living on the autism spectrum or they're living with mental illness. It's really important to use the language that is the least stigmatizing for people to feel comfortable within the communities and organizations that you are working within. So I'm going to talk a little bit about the youth programs that we have available at NAMI, Wisconsin, and then I'm going to give you a ton of resources. Megan did talk about how much of an overlap there is between, youth living on the autism spectrum disorder and youth living with mental illness. That Venn diagram is closer to a circle than we would like to see. So we really want to provide you resources and support that would be available for all of you. And the, youth or adults in your life that you're working with. So the first thing is a video, and it's kind of a fun one. It is meant for youth, ages, anywhere between about 3rd grade on. I like to show it to adults because I think it's fun, but really it talks about coping skills and things like that. And it really helps to understand mental illness for the first time, but it also can just help to understand differences in between people. So I'm going to play this video for you all. It's about 5 minutes, and just know it is a resource that's available for you on YouTube from our office. And let me know if you can't hear it.
We can't hear it.
Yeah, when you shared, did you make sure to check the 2 boxes at the bottom?
I thought I did, but doesn't always work the way you want it to. Okay, let's try this again.
Let's talk about mental illness with NAMI, Wisconsin. NAMI is an acronym that stands for the National Alliance on Mental Illness, and we are an organization that helps people who are affected by mental illness. Mental illness can sometimes be a tough thing to talk about, so if you need to pause this video or take a break at any point, please feel free to do so. So, what is mental illness anyways? A mental illness is a type of illness that you can't see that happens in the brain. Just like physical health, we all have mental health. It's our thinking, our feelings, our emotions, and our moods. Feeling down, sad, or stressed is a normal part of life, just like it's normal to feel happy, confident, and carefree sometimes. We all have positive and negative emotions that come and go based on what's happening around us. When you start feeling overwhelmed, anxious, or stressed out, it's a good idea to check in with your mental health and practice some positive coping skills. Coping skills are tools you can use to help you handle difficult emotions, decrease stress, and maintain positive mental health. Some helpful coping skills you can try include deep breathing, coloring, reading, or a mental health check-in. Let's try a mental health check-in right now. Look at this thermometer. Are you feeling tired blue, calm green, nervous yellow, upset orange, or out of control red? If you are red, orange, or yellow, it would be a good idea to use a coping skill to try to relax. Now that we know a little bit more about mental health and coping skills, let's talk about the difference between mental health and mental illness. A mental illness is an illness that affects the way people think, behave, feel, or interact with others. There are many different types of mental illnesses, and they have different symptoms that impact people's lives in different ways. A lot of people live with a mental illness. In fact, 1 in 5 people, that's 20%, will be diagnosed with a mental illness in their lifetime. The other 4 out of 5 people will know a friend or family member that is living with a mental illness. So this affects everyone. Have you ever broken a bone? What did you do? You went to the doctor to get an x-ray, and they put your arm in a cast. Breaking a bone is common, and no one told you to just snap out of it, as if you could control whether or not it was broken. How about when you're sick with the flu? You take time off to rest, take care of yourself, and maybe even go to the doctor. No matter how hard you try, you can't use the power of your mind to mend bones or cure illness. Like a malfunctioning traffic light turning the wrong color and messing up traffic, mental illnesses are sometimes caused by chemical imbalances in the brain, causing signals to be disrupted. They can make it hard to do things like homework, chores, and hanging out with your friends. Support friends with mental illness the same way in which you would support a friend with a broken arm. Let's review some common mental illnesses. When someone feels sad almost all the time when they're in a happy environment, they might live with a mental illness called depression. Living with depression feels like there's a rain cloud stuck over your head that keeps pouring down on you, but no one else can see it. Everyone feels sad sometimes, but when you're sad all the time, you should reach out to a trusted adult for help. Another example of a mental illness is when someone feels nervous or scared, even in the calmest of situations. This is called anxiety. While everyone may get nervous over a test or a big event, a person who lives with anxiety has a hard time enjoying life like they should because their intense fears and worries get in the way. People who live with a mental illness aren't choosing to feel this way. In fact, they can't control it any more than you can control having a sore throat. And to get better, they need to reach out and ask for help. Telling a trusted adult, including a parent, teacher, grandparent, or school counselor that you don't feel well is the first step. Most people who live with a mental illness get better. They can talk to someone like a therapist, learn a new coping skill, or even take medication from a doctor. A very brave person can live with anxiety, and a person who appears happy can be living with depression. If you think you may have a mental illness, do not be afraid to go to the doctor or talk to a trusted adult. You are not weak, it is not your fault, and you are not alone. Let's recap what we learned today. First, 1 in 5 people live with a mental illness, so it's pretty common. Second, we all have mental health. Check in on yours every now and again. Third, finding coping skills that work for you to help you feel better is crucial in keeping positive mental health. Fourth, if you're not feeling well, ask for help from a trusted adult. And finally, support someone living with a mental illness the same way you support someone with a broken arm. There are people all around you with mental illnesses leading normal lives. By talking about mental illness and supporting each other, we can heal minds as easily as we heal bones.
So that is our Let's Talk About Mental Illness video. It also comes with worksheets and coloring sheets, and it's available in Spanish and in English. We also have stickers available if you're interested in ordering some, if you just have one kiddo at home, or if you work for an organization that serves youth or a school, you're absolutely able to order those for free from our website. And you're going to get this PowerPoint with the website on it afterwards as well. And the cool thing about this video is, especially if you have siblings, friends, cousins of a youth who is struggling, it's a really great way to kind of explain to them for the first time, you know, what is mental illness and, you know, why people might feel differently. So that is a really great resource. It's on YouTube, it's on our website. And again, I will send out this, we're going to send out this PowerPoint afterwards with all the links. The other program we want to talk about quickly is called Ending the Silence. This is aimed more at high schoolers, as Megan kind of talked about. It's really, really important to catch signs and symptoms of mental illness early, in that you have a quicker recovery outcome if you get treatment earlier, right? And so Ending the Silence is a program that we have that is really aimed at ninth graders, but can be done at any point in high school. And we're going to just show you this very quick 30-second clip that kind of talks about it. And then I'll talk a little bit more about how this is available.
1 in 6 youth aged 6 to 17 experience a mental health condition each year, and 50% of youth don't get treatment. We want to end the silence so you're not afraid to speak up.
Mental health is health. Know the signs.
Know you are not alone.
Know that people care.
And that we all have the power to end the silence.
For more resources, you can always go to NAMI.org.
So that was a very, very quick clip, but really what this program does, it talks about how to notice signs and symptoms around mental health and mental illness. It is available for schools online and for individuals who are interested online. And then also some of our local affiliates offer the presentation as an in-person version where somebody comes in, a young adult who experienced their mental illness symptoms for the first time as a youth. We'll talk about their experiences and you get that connection there. The next thing I want to talk a little bit about is our programs for parents and caregivers and how important it is to be able to get the education you all need and then also the support you need as well. So with that, we have two programs that I want to talk about. The first is called NAMI Basics on Demand. NAMI Basics on Demand is a 6-module class that is available online. And it is really self-paced, which is amazing for any of you who are parents and know what the struggle is to get that time available to take a course online. So you can start and stop at any point. And really it walks you through the beginning of a child having, you know, symptoms and what that might look like as a parent, all the way through to being able to advocate for yourself, whether it's in the medical setting or in the school setting. It goes through things that you all may know about, like what is an IEP and things like that. But it also really gives you what you need, which is an amazing part of the program. So the way it works is that there are different modules, and if you feel like you need different information on each one, you can kind of click into each different area. And there will be extra materials based on what you need. And at the end, you will have a library of PDFs that you can kind of take away with you. So there's a lot of video-based parts to it as well. But, you know, if you specifically were worried about a child that may be experiencing depression for the first time, you know, you can click on the different elements that have to do specifically with that and take that away from it with you. So each individual is able to kind of take what they need from that program, which is why it's so amazing. So it's called NAMI Basics on Demand. It is through NAMI National. And all you have to do, it's completely free, is just register with an email and it'll save your spot in the course based on your email login to it. So it's just a really great resource, especially, you know, for somebody who is experiencing things with their kid for the first time that they just don't have a lot of background on. And even if they do have a lot of background, you know, we talk to people who say they work within the medical system or the school system all the time, and really didn't realize how hard it was to manage with their own children. The second thing I want to point out is we do have family support groups, and those support groups are for people who are loved ones of those living with a mental illness, and you know, maybe struggling and really want to reach out for some extra support. Support groups are a great drop-in free way to get that support. You may have support groups in your area that are in person, but we also have them online as well on Being Together. So we have a site on our website called Being Together, and it really hosts all of the support groups that are available for free online through NAMI across the state of Wisconsin, whether that be a general family support group, a specific peer support group, or you know, we do also host some links to youth support groups on there as well. And then we also have some different support groups that are outside of NAMI but are free and available, linked on there as well. So you can give it a check out and see if one of them may be right for you as well. Now I have some more general resources to give to all of you today. The first is to find your local NAMI affiliate. So in order to find your local NAMI affiliate, we have namiwisconsin.org/findmy, and I'll send that over to you. And as Megan alluded to before, we have 27 local affiliates, and then we also have some teal space you'll see on this map. If you do not have a local affiliate in your area, you're welcome to talk to the nearest local affiliate or reach out to NAMI Wisconsin. So we at NAMI Wisconsin are happy to help. We host a support line, which I'm going to get to in a second, but we can also direct you to resources in your area around mental health and mental illness, and other resources as well. You know, we get a lot of calls about housing. We get a lot of calls about different, you know, needing food, needing different medical services, and we can just direct you in the right direction. But our main resources we support is those around mental illness. And with that, we put together a resource guide. So NAMI Wisconsin puts out a resource guide that is available to anyone. It's on our website. And we also do have it in book form, and you can order that on our website as well. It's over 100 pages, which sounds a little daunting when I say it, but it's really there for you to take what you need from it. It goes over all of the mental illnesses themselves and support and resources for all of them. It also goes over things like the Chapter 51 process. It goes over you know, what to do for family members for support, and then provides different resources for every county in Wisconsin as well. And so that is really an important resource. You're trying to navigate the mental health system or help someone navigate the mental health system. And it includes information on insurance, housing, legal issues, treatment, medication, and more. And again, this PowerPoint will be sent to you, and it has the link. The other resource I wanted to make sure you are aware of is the Kids, Teen, and Youth and Young Adults site on NAMI National's website. And this really has a ton of resources that are available nationally, and a ton of research and information for you to look over if you're looking for something specific. Things like what to do if you're in a crisis, residential treatment, how to talk to parents and guardians if you're somebody who is in that professional role, social media and mental health. It has a ton of resources that are available to you if you are interested. The next thing I want to talk about is 911 and 988. So as many of you probably know, 988 launched last July, and 988 is the new suicide and crisis lifeline. It is now a 3-digit number code, just as 911 or 211 is. And we're really excited about it at our office. It is in Wisconsin, hosted out of Green Bay, but anywhere in the United States, you can call this number and receive crisis help for someone who's in a mental health crisis. And it's really important to know that we at NAMI Wisconsin and most mental health organizations really promote calling 988 over 911 if there is a mental health crisis, unless you or the person is in physical danger to themselves or others. So the 988 is trained counselors. They're going to talk you through a situation. They're going to provide resources. They're going to make sure that the person gets the help that they need. However, if you are in physical danger or the person that you're trying to help is in physical danger, then it really is important to call 911 for safety reasons. If you do have to call 911, something I want to say, if you are calling for an individual who lives with a mental illness or is on the autism spectrum, something that's really, really important is to ask for a behavioral health officer or a mental health officer. In most parts of Wisconsin, there's a program called CIT, which is Crisis Intervention Teams Training, which is a 40-hour training for officers on how to deal with mental health crises. And it also does include developmental disabilities and autism spectrum disorder and how to work with individuals on that spectrum, and it really dives into how to best respond. So if you do have to call 911, regardless of the situation, if someone is having a mental health crisis or the individual you have to call about for whatever reason is on the autism spectrum disorder, spectrum, excuse me, our recommendation is that you ask for a behavioral health trained officer. So I just wanted to make sure that we put that in there as well. And then we're going to end with quite a few resources here for families. I'm just going to throw them on the screen here, but all of these are for all of you to be able to reach out to if needed. Some are Wisconsin-based, some are national, and they, I'm not going to go through them individually, but because you're going to get the PowerPoint, these are all resources that are available to you and may be helpful for you if needed. And so finally, we wanted to leave you with some discussion questions if you're in an in-person location or just to think about for yourself, which is that we wanted to ask if there is any of these programs stand out to you and would be helpful for you, or if you've seen any of these warning signs in someone in your life or in yourself, and then what were you able to do? So either questions to think about or to discuss as you go forward and throughout your day and are thinking about all of the content that was given to you and all the resources that are available. With that, I know that there is a lot going on in the, well, I haven't read it, but I have 18 chat notifications. So we'd love to answer a few questions. I think we have about 5 minutes left if anybody has questions for us. So I'm going to stop sharing my screen.
I would say if you feel like you want to unmute or throw it in the chat, we'll give it a couple seconds because if you throw it in the chat, it takes a little while of time.
Absolutely. And we're here to help if you all need anything, you know, next week, a year down the line, you can call our office. We do have a support line. I said I would get back to that, but I don't think I actually did, which is NAMI Wisconsin has a support line where we can refer you to resources. NAMI National has a national support line. They can refer you to resources. They also have a text line. And then if you do live in an area with a local affiliate, all of our local affiliates have support lines as well. And they're gonna give you the most local resources. So it just depends on your needs. We'll refer you to your local affiliate and give you resources, you know, and the same with NAMI National as well. So that's what we're here for, and we're here to help. And we really are hoping that this information was helpful and that these resources may be helpful to you, if not today, maybe down the line. Anyone have any questions?
All right, well, it looks like you gained us our 5 minutes that Tim took away from us earlier today. So to even that out, thank you so much. Please note, there were tons of resources thrown in that chat. So if the subject really hit home for you, make sure you have that chat. I know Tim's gonna also pull it off of Zoom for us to put into our resources. But yeah, go scroll back up. So if possible, Emily or Megan, can you put back your questions? Share back up that screen of your questions. And we'll leave that on the screen while we take our next break discussion time. So I've thrown in what the rest of our day looks like here. Feel free if you're at a location to discuss the prompting questions that they provided us. And we will see you back at 11. Thank you so much, Megan and Emily.
Thank you for
Thanks
having
for
us.
having us.